CPR procedures for infants, those less than 1 year of age, are similar to those used for children. A few modifications can accommodate infants' smaller size. When approaching a motionless infant, tap and shout to see if there is a response. Infants who do not acknowledge your contact are considered unresponsive. While checking for responsiveness, also look at the chest to see if the infant is breathing. If the infant is not breathing or is only gasping, the infant needs CPR. Ask a bystander to call the local emergency number, usually 911. If you are alone with an unresponsive, non-breathing infant, first perform 2 minutes of CPR. Then make the call to 911 yourself and return to care for the infant. Place the infant on a firm, flat surface for CPR. CPR is a combination of chest compressions and rescue breaths. Place 2 fingers in the center of the infant's chest, just slightly lower than the nipples. Push the chest down at least 1.5 inches and let it return to its normal position. Give 30 chest compressions in about 18 seconds. After 30 compressions, tilt the infant's head back slightly. This action moves the tongue away from the back of the throat in an unresponsive infant. Each breath should last about 1 second and make the chest rise. You may want to use a breathing device during rescue breathing, if available, to help prevent the possibility of disease transmission. Repeat cycles of 30 chest compressions and 2 rescue breaths until an automated defibrillator is available, until the infant is revived, until you are relieved by someone else capable of performing CPR, or until you are too exhausted to continue. Whenever an automated defibrillator, commonly called an AED, is available, stop CPR and use the device. Apply the AED pads to the infant and follow the prompts of the device. Use pediatric pads if they are available for the device. AED use is explained in a later section of the program. If a breath does not make the chest rise, retilt the head and try another breath. If still unsuccessful, assume the airway is obstructed and give 30 chest compressions to dislodge the obstruction. Look for an object in the infant's mouth and remove anything visible. Reattempt breaths. This is usually all it takes to dislodge an object and clear the airway.